Now, how do we treat? Remember, never ever start giving medications when you have not done your CURB-65 score. You can't treat without a CURB-65 score. Okay, it's very, very important. Why is CURB-65 score important? I'm sure you've heard of CURB-65 score. CURB-65 score. You're trying to put it in your mind, but there is an easy way to remember why it is important. The reason why CURB-65 score is important because remember the complications of pneumonia, systemic and then local. Systemic and local. All right. The systemic complications include meningitis. All right. Includes hypotension. All right. In those cases, and all of this will be as a result of sepsis, you see. In those cases, the patient can appear confused. All right. So that's why confusion is one of the criteria. All right. There'll be AKI. Okay, so that's why urea is also one of the criteria. All right. Of course, if the respiratory rate is greater than or equal to 30, that one there, you know that's very severe. All right. Then you go to B, the BP. Usually in sepsis, they have hypotension. So less than 90 BP systolic, less than 60 millimeters of mercury diastolic, you know that you are in a serious situation. All right. And of course, if the patient is greater than or equal to 65 years of age, it's also a marker of severity. So this is why we do CURB-65 score. So it's not something you just have to chew. You understand the reason behind doing CURB-65 score, because if it is high, you need to admit the patient because the patient's life is in danger. All right. So if you do a CURB-65 score and get only about 0 to 1, you need to treat it on OPD basis. That means you just be giving orals, all right? But 2 and above, you need to admit the patient. If the person gets 3 and above, you need to admit the ICU. Okay, so that's why we do a CURB-65. But you know that even though you may not have some of the parameters on the CURB-65, okay, when the person has coexisting disease like CCF, extensive disease, you see funny things, serious things on the chest X-ray, multiple lobe involvement, all right? SpO2 is less than 90. The patient has severe tachycardia, 120 and things. You can't admit on OPD, you can't treat on OPD basis, all right? So it's not just about the CURB-65 score. You need to look at other things as well. Are there underlying diseases? Are there coexisting comorbidities? All right. Okay.